name is Lars Søndergaard. I'm a cardiologist based in Copenhagen in Denmark. I'm here at EuroPCR 2022 in Paris. It's my pleasure to be joined by Andrea Buono from Brescia in Italy. So Andrea, you just had accepted or published your new ITAL-neo study in JACC intervention. Maybe you can just tell us why you did this study?
Thank you, Professor, and good morning to everybody. The EuroPCR is a retrospective observational multi-center independent registry with the main aim to assess the safety and efficacy of the ACURATE transcatheter earth valve in the context of THV. We planned this study based on the evidence available so far in literature demonstrating non-negligible incidence of more than mild paravalvular leak with the use of the earlier generation of transcatheter earth valve produced by Boston Scientific and named ACURATE-neo. So for this reason we want to investigate the efficacy of the engineering refinement with the new generation device.
So maybe you can just shortly tell us what have been changed with the ACURATE-neo 2?
Of course. Mainly the new generation maintained the key clinical feature of the old generation, but incorporating some engineering refinements such as the presence of a radio marker on the delivery cutter, able for a more precise implantation, but overall the presence of a taller outer skirts with the potential to reduce the incidence of moderate or greater paravalvular leak.
So how did you design the study?
We designed the study in a retrospective nature, but however, for the non-randomized nature of the registry, we perform a one-to-one propensity score match in order to make a more comparable comparison between the patients treated with the old generation and the new generation. So we enrolled 900 patients, 680 treated with the earlier generation, whereas 220 received the ACURATE-neo 2.
And you matched them, so you came out with more than 200 patients in each group?
Yes, the one-to-one propensity score at the end provide us 205 pairs of patients.
So what is the main outcome in this study?
The primary endpoint was defined as the incidence of moderate or greater paravalvular leaks at pre-discharge in the cardiographic assessment, and we observed a threefold reduction in the primary endpoint with the use of the newer generation.
So what was the rate of more than mild with the ACURATE-neo 2?
It was 3.5% in our registry, comparing 11.2% with the ACURATE-neo, and that data is comparable with previous evidence provided in literature so far.
You also have a number of secondary endpoints. Maybe you can just briefly tell us what they showed.
We define it as secondary endpoint technical success and some short-term clinical outcome intended as 90-day efficacy and safety according to modern validity criteria. What we observed is that technical success at the end of the procedure was comparable in both codes, and this was intuitive because, as I told you, the two devices share the same key features. Instead, we observed a numerically higher, despite not statistically significant, rates of 90-day safety and efficacy with ACURATE-neo 2.
Yeah. So just to conclude, I mean, you did this study here, you showed that the rate of more than mild paravalvular leak was very low, 3.5%, very high technical success rate, almost 98%, and you still have all these hemodynamic features with low break and large opening area. So I think this is certainly a valve which could be primed for moving to patients with longer life expectancy. So where can you find this paper if you want to read it?
We can find JACC Cardiovascular Interventions. It is a big pleasure to mine to publish on JACC Cardiovascular Interventions.
And you also got the opportunity to present it here in Paris. When is that?
It will be the object of today's late-breaking trial this afternoon.
Okay. Congratulations. Yeah.
Thank you.